Okay, you are on air.
Okay, assalamu alaikum everyone. Thank you for joining us. Today we will be giving some information on the COVID-19 vaccine. This pandemic has caused a lot of issues in the past year for us, but alhamdulillah, companies have come out with a vaccination that will inshallah bring us closer to going back to normal life. So the purpose of this seminar is just to give you some information on the vaccine, and I will turn it over to Brother Bashir to start us off with a dua, inshallah.
بسم الله الحمد لله وصلى الله وسلم وبارك على رسول الله. اللهم علمنا ما ينفعنا وانفعنا بما علمتنا آمين. أما بعد, dear brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to this great seminar. It is about how you take care of your health, take charge of your health. As you know, this pandemic had made a lot of issues, a lot of problems for the entire world. And as you know, as in Muslim, protecting your health, taking care of your life is one of the most important priorities. Al-ulama, they consider preservation of life is one of the universal needs that all religions came to protect it. And the Prophet ﷺ, he mentioned that. He said, ما أنزل الله داء إلا وأنزل له دواء علمه من علمه وجهله من جهله. Whatever disease or sickness or pandemic came in the life of a human being, there is a cure for that. Some people, they know it, and some they may not know it. And the Prophet ﷺ also said, تداووا عباد الله. I mean, seek cure when you get sick. And that's why we have this, session today with the Dr. Hussein, inshallah, to talk about the scientific and the medical aspect of this vaccination. Many people, they think, oh, vaccination, a lot of issues going on. I'm not going to get vaccinated. I'm a believer in God. I don't want to get that. There is nothing going to harm me. No, because taking care of your health is required, is mandatory by Allah subhanahu wa ta'ala, by the Quran. Allah said, وَلَا تُلْقُوا بِأَنفُسِكُمْ إِلَى التَّهْلُكَةِ. And don't put yourself in harm. And the Prophet ﷺ, he mentioned that a long time ago when this pandemic took place in one of the places, and he said, if you are in a city or in a place where pandemic is there, you should not move out of that. If the pandemic is one place and you are out, you must not get in that place. So welcome, inshallah, all the community members to join us at this seminar, inshallah, to learn more about that aspect, the scientific aspect, with Dr. Hussein. Jazakumullah khair. Assalamu alaikum wa rahmatullah.
Thank you, Brother Bashir. So we'll go ahead and start. Just to introduce Brother Suleiman, a respected member of our community, is an orthopedic surgeon who also sits on the COVID-19 physician steering committee at Genesis Health System. Assalamu alaikum, Brother Suleiman. Thank you. Well, thank you for joining us today. So just to start off, if you could give us like a brief overview of the current status of COVID-19 itself right now.
So numbers across the country and our region have been going down. The positivity rates have also been going down. What we've seen in the last few weeks is we've actually plateaued. So numbers are starting to plateau at still kind of a concerning level. Across the country, that's around 60,000 active cases per day. Our death rate still is around 1,500 people dying per day across the country. Across the Rock Island and Scott counties, we've seen positivity rates much lower than 10%. But over the course of the last 1 to 2 weeks, those numbers have plateaued and even slightly increased. So although things are looking better, still we have a little bit of ways to go.
Okay, inshallah. Yeah, I have heard in the past, I believe, week or two, we are seeing a little increase in the Quad Cities, so that's important to note. So for the vaccine itself, where in the community can people go to get the vaccine?
So right now, the vaccine distribution is a priority, but it's also a little bit complicated in terms of scheduling, and that's because multiple different avenues are being explored to get as many vaccines in people as fast as possible. So in general, the best health resources right now are actually the websites for the Rock Island Health Department and the Scott County Health Department. So if you're a Scott County resident, the Scott County website will direct you in terms of which vaccine you qualify for and which locations to get those vaccines from. If you don't have access to the internet or to the websites, you can also contact your primary care doctor, and they can also help arrange the vaccination or put you in contact with the appropriate person who can help you.
Okay, inshallah. Just to clarify to everyone that if you're living in the Quad Cities on the Iowa side, that will be the Scott County. You would be a Scott County resident, and on the Illinois side, you would be a Rock Island County resident. Generally, if you are in the Quad Cities.
And on those websites, they will direct you to Walgreens, Jewel-Osco, to Hy-Vee, to local community centers, community health centers. There's a vast variety of different vaccination options for individuals, and those websites are updated almost on a daily basis. So if you check it, you should check it on a daily basis. Appointment times and slots also open up quite frequently. So although it may be closed on one day where all appointments are taken, even 24 hours later, that can change. So it's very important to check those websites on a kind of a more frequent basis.
Okay. So there have been in the past few months a few options that came out for the vaccine. Pfizer, Moderna, and most recently Johnson & Johnson. Could you speak on what the options entail and which one maybe is better, or is there a better option?
So in general, I think there's a little bit of confusion about the vaccinations. There's actually dozens of vaccine candidates that have been studied across the world, and there are multiple different vaccines in different phases of clinical study for FDA approval. In the United States, the 3 current approved vaccinations that have gone through all 3 phases of the vetting process and are approved by the FDA. The first one that was approved was the Pfizer vaccine. The second one that was approved was the Moderna vaccine, and the third one, most recently approved, was the Johnson & Johnson vaccine. Now, they all work in different ways. They all have some subtle differences in terms of how they're manufactured and what the mechanism of how the vaccination works. In general, the most simplistic thing is any of these vaccines will prevent severe COVID-19 infection and have been shown to substantially decrease hospitalizations and the chance of dying from the actual disease, which is actually what we want to happen. Now, some of them, because they were all studied at different time frames, have a slightly different efficacies in terms of the percentage of individuals that still get low-level COVID infections after they're vaccinated. The Moderna and Pfizer vaccines are based off of a technology that uses something called messenger RNA. There's been a lot of confusion in the media about messenger RNA. Messenger RNA is technically a newer or more efficient way of creating the vaccine. And the mRNA vaccines were actually manufactured, or we had the basics of those vaccines even within weeks of the COVID-19 outbreak occurring last year. The process to get those vaccinations manufactured and studied to make sure they're safe for human use has been the priority of all of last year. And so these medications were studied in tens of thousands of people for many months to make sure they were safe and effective. And all 3 different vaccines have had to prove that they're effective and safe for utilization. The Pfizer vaccination and the Moderna vaccination, the mRNA technology is a manufactured piece of messenger RNA that's put into a droplet of a lipid solution. It's injected into the body. Your body then absorbs this lipid molecule. This RNA, which is technically made from the same material as DNA sequences, does not enter your DNA. It does not change your DNA. It does not alter your DNA. Your body uses this messenger RNA to manufacture a protein that's similar to the protein that shows up on the virus. Your body expresses that protein, and then your body creates antibodies against that protein. That messenger RNA technology is what the Pfizer and Moderna vaccinations use. The Johnson & Johnson vaccine is actually based off of a different technology that's already been used for many different type of vaccinations, where we take an adenovirus, which is a different virus than the coronavirus. And the adenovirus is a weaker, attenuated virus, and we insert into that virus the material that then produces the same protein, the spike protein. Your body then is injected with this very weak, safe adenovirus, which then goes into your cells and stimulates a similar response to the immune system by creating this spike protein, which then your body creates antibodies against. And so there's a little bit of controversy because some people believe the Johnson & Johnson vaccination is a second-tier vaccination or is a kind of a not as effective vaccination. The goal for vaccination, which we think is successful, is a vaccine that is 50% efficacious. And the Moderna Pfizer vaccinations are over the 90% range. The Johnson & Johnson vaccine is within the high 60 range. And the goal, if it's to prevent severe infection or death, is met by all three vaccinations. And so any vaccine that's available at the time that you're able to get the vaccine is the vaccine that you should try to get. Now, there are some different criteria for vaccination. The Pfizer vaccine is approved for individuals 16 and over. The Moderna vaccine and the Johnson & Johnson vaccine are approved for individuals 18 and over. The approvals for all the vaccines, the CDC has approved them for utilization in pregnant women, in women of childbearing age, women that are breastfeeding. There are some criteria that if you have allergies to certain components of the vaccination, where you may not be a candidate. Even patients that have had COVID-19 infections, these vaccinations are very important because they have been proven to much substantially increase the amount of antibodies your body makes. So even if you had COVID-19 or got the antibody treatment or convalescent plasma, although there are some restrictions that you need to be 3 months away from those treatments, the vaccine is still very important to get because we've had multiple cases where people are getting infected with COVID-19 again. The second part of this is that there's new variants that are showing up. People have heard in the news. There's multiple variants from the United States. There's variants labeled the British variant, or there's the South African variant. The virus is also mutating and changing. The British and South African variants are much more contagious, 50% more contagious. And there is some research that shows the British variant is slightly also more prone to make you more sick, which i.e. could create a higher fatality level. All the current known variants, you are protected at some level with the vaccinations that are currently approved. And the faster we can decrease the number of people that are exposed to COVID-19, the less opportunity the virus will have to mutate further. So it's very important, not only for ourselves to keep ourselves and our people that we expose, our close family and friends, but also in general, the vaccination is very important because if we were trying to prevent COVID-19 from mutating further into something that may prolong this pandemic, the sooner we can decrease the number of people that are exposed to COVID-19 or infected, the better it is for the whole society and the world.
Jazakallah. So just to recap, so the vaccines have been tested and by the CDC and approved by the government. They are available to the public, and all of them are have high efficacy rates, meaning that they are effective. And either option, all three that we have said, Pfizer, Moderna, and Johnson & Johnson, are all vaccines that will help reduce the symptoms, the strong symptoms of COVID-19. It is not the case that if you get the vaccine that you will not get COVID. It is still possible for you to get COVID, but from these vaccines, you will have more mild symptom, inshallah.
Yes, and in addition, there's many other vaccines that are still being studied. And I'm sure because we have a large part of our community is from overseas, they have heard people back home getting administered vaccinations that have originated from Russia, China. There's a European vaccination, AstraZeneca, the Sinovac from China, Sputnik 5 from Russia. And there's actually a significant other number of vaccinations that are in trial study right now. And so this information is as of now, but it's not to say that within the next several months, there won't be other vaccine candidates that are also going to be approved. The US has actually not approved some of the vaccinations that have been presented to the FDA. So the goal has never been to rush a vaccine that's quote unquote experimental or dangerous to the population. These vaccinations have been very carefully studied, and the other vaccinations that are sometimes available in other parts of the world have not yet been approved by our country to use here. And that is because our standard for what we require the vaccine manufacturer to show in terms of safety, efficacy, are much higher and have not been eroded because of the pandemic.
So from the vaccine, you did mention that the ones that the government in the US has approved are not dangerous. Can you speak on some of the side effects that these vaccines have?
So in general, for the Moderna and Pfizer vaccinations, and the Johnson & Johnson one, but the Moderna and specifically Pfizer vaccinations, if you have an allergy to something called polyethyl glycol, which is PEG, that is the fat molecule that the mRNA is put into that goes into your body. So if you've ever been told that you have an allergy to PEG or polyethyl glycol, you should not get the Pfizer or Moderna vaccination, or you should check with your doctor first in regards to your allergy. Even patients that have had prior allergies to things like the influenza vaccination, rabies vaccination, measles, mumps, rubella, you still could be a candidate for the COVID-19 vaccinations. And once again, if you ever have questions about prior interactions with vaccines, you should talk to your doctor, but you still potentially could be a candidate to receive the COVID-19 vaccination. Now, in general, the way a vaccine works is it stimulates your body to create antibodies. So we are trying to induce antibody production in your body, which is your body's immune system. That's your army inside your body that protects you. Now, the way the immune system is triggered is by creating a level of inflammation. So the Pfizer and Moderna vaccinations are two-step vaccines. The Pfizer vaccination, you get an initial vaccination, and then you get a booster shot 21 days later. The Moderna vaccination, you get an initial vaccination, and you get a booster shot 28 days later. And the Johnson & Johnson vaccination is a one-shot vaccination. Now what happens is when your body creates the version of the spike protein that your body then creates the antibody to, that causes sometimes soreness in the arm. It can cause some redness. It can cause some lymph nodes to enlarge in the area where the vaccination was given. It can create a low-grade fever. It can make you feel slightly ill. Typically, those symptoms are very more on the mild end. For some people, they can be moderate enough to where, especially after the second vaccination with the Pfizer or Moderna vaccine, where you may feel like you would take a day or two off of work. But typically, those symptoms are easily managed with hydration, with medications like Tylenol, Motrin, and with simple things like icing the area if you're, let's say, for example, if your arm is sore. But usually the symptoms subside from the exposure to the vaccination within usually 24 to 72 hours.
Okay, inshallah. Yeah, just to reiterate, the COVID-19 vaccine Pfizer, it's a two-shot process. So you get an initial vaccine and then 21 days later, I believe you said, correct?
Correct.
21 days later, you will get a second dose. And again, for Moderna, that is also a two-shot vaccine. You get initial dose, then 28 days later, you get the second dose, and then Johnson & Johnson is just one vaccine.
So a lot of people ask questions about why 2 versus 1. So these are all based on the fact that these vaccinations were studied that way. So we don't know if one Pfizer vaccination or one shot Moderna vaccination is protective enough, because that's not the way we studied them last year when we were deciding if they were safe or effective. So although there's studies right now going on to see if a one-shot version is good enough, right now we do know and we recommend that you get both shots if you are getting the Pfizer or Moderna vaccine. The Johnson & Johnson vaccination, the way it was studied, was always studied as a one-shot vaccine. And so all three of these vaccinations produce antibodies 9 or 10 times higher than if you had COVID-19 infection, even at a moderate level. So they're giving you much, much more protection than even having been exposed to the disease before.
So like you said, especially for obviously Pfizer and Moderna, you need the 2 doses. What happens if I don't get the second dose? Should I go back, start over, or how does that work?
So because the supply of the vaccinations is right now a lot less than the demand, there may be the possibility that when your 21 or your 28-day period comes up, that there's no supply available for you to get your second shot right away. Even in that case, if the second shot is delayed by even a week or 2, or sometimes even longer, it's actually still recommended to get the second shot, and the research shows the second shot still is very helpful. The recommendation now is not to do one shot. We don't know how long that one shot is protective. We do know it's partially effective, but right now research is being conducted to see if a one-shot regimen is good enough. We don't know yet. So it's not recommended by the CDC, the FDA, or the US authorities that you only do one shot. In some countries, they are for supply-demand issues, they are giving patients that have had prior exposure with COVID just one injection, but that's not the way it was studied, and that has not been approved in our country. And we still recommend that you get all the doses as soon as the time frame that's recommended as possible.
And how long would you say that it takes to build up immunity with the vaccine, and how long are we protected for?
So the first question is, how long are we protected for? We don't know yet for sure. And so the protection seems to be at least multiple months present, but we don't know how long the protection is going to be good for. And that's why there is a possibility that as we get more research and have more information and more data points, that there may be a need to get a booster injection, either to protect us against variants or to provide us more antibodies in our body to protect us at the same level that we're currently protected. As of now, there's no need for a booster injection, and patients that have gotten, or people that have gotten the vaccination, even the ones that were in the trial studies, which were done last year, those trials started last March. So to give you perspective, the people that got those early experimental vaccination doses to study to see how they were doing, they still are protected 1 year later up until now. But how long will that protection last, and when will these variants need to cause us to have a booster injection? We don't know. The second part of it is, when do your antibodies respond? The typical answer is within 2 weeks, you are already mounting substantial antibodies to start protecting yourself after the vaccination. In the Johnson & Johnson trial, you're actually getting more protection up to 40 days, 45 days after your initial injection has been completed. There are some patients that do get infections after their first dose if they're exposed in the community to COVID-19. But every week that goes by after your injection is completed, you are mounting a better response. So, but the general answer is about 2 weeks afterwards, you're starting to get substantial benefit. For the Johnson & Johnson vaccination, even 45 days afterwards, you're still increasing the number of antibodies and the level of protection from the Johnson & Johnson vaccination.
Okay, sure. So if an individual has already had COVID-19, do they still need to get the vaccine? Is that the case?
Yeah, so the recommendation is that yes, you should still get the vaccination. Now, there might be some difference in timing. So if you received IV antibody therapy to treat your COVID-19, if you received plasma from donors to treat your COVID-19, or if you had COVID-19 infection, the CDC is recommending that you have a 90-day period before you get the COVID vaccination. But once that is completed, you should get the full doses of the vaccine that you're provided. And that vaccination still is much more protective than having the initial COVID disease itself. And so even if you've had COVID-19, you still should get vaccinated. You should talk to your primary care doctor about when that should be, because it may be different than somebody who has not had COVID-19. But yes, you should still be vaccinated, even if you've had COVID-19 infection.
Okay. And I know you mentioned a little bit earlier, but should those who are pregnant and breastfeeding get the vaccine? Is that approved yet, or is it still dangerous? What is the status of that right now?
Yeah, so the bottom line is you should discuss it with your doctor. So they should discuss it with patients that have those concerns. Definitely need to have a one-on-one conversation with the provider about their degree of need, safety, etc. However, the CDC has approved all 3 vaccinations for utilization in pregnant or breastfeeding or soon-to-be pregnant females. And so it is not a contraindication from the CDC, but at the same time, I do think if anyone has a question, then they should talk to their doctor just to be on the safe side.
So far we've talked about, some of the problems with the vaccine and how it helps us as well. Can you tell us right now who is eligible right now in Rock Island County and Scott County to get the vaccine?
So in general, the number of individuals that are eligible have been increasing, and it's definitely a little bit different state to state, but it's pretty much similar now as of last Monday, because Iowa is kind of on the same page as Illinois right now. And based on President Biden, he had a speech that he gave last week, and he's committed to try to open up vaccinations to pretty much the majority of the eligible population around May 1st. And he's had a commitment that he wants from the states that on or before May 1st, that the vaccine should be allowed for anybody over the age of who's eligible for the vaccination, regardless of where they work, pre-existing medical conditions, etc. But right now, if you have a pre-existing medical condition and you're over the age of 18, you would be eligible for the vaccination in both Iowa and Illinois as of last Monday in Iowa, and it's been like that for several weeks now in Illinois. But still, the supply of the vaccine is the rate limiting step. And so even in some of the primary care clinics at Unity Point and Genesis, they're still trying to prioritize higher risk individuals as best as possible.
And what about for children? When can the community kids be eligible for the vaccine?
So like we talked about, the FDA has a very extensive approval process for vaccinations. Currently, they are testing all 3 vaccines on children. So across the country, there's already test groups of children who have volunteered, the parents have volunteered to be part of a study to make sure that the vaccination is safe and effective for children also. But I think last thing I saw was that the goal hopefully will be sometime in 2021, likely towards the fall or winter, where potentially that would be the earliest that they will potentially have the data required to allow the vaccination in children. And what the youngest age that is currently being studied, I'm not aware. But currently it is not approved for children, the Moderna or the Johnson & Johnson vaccination, not approved for anyone under the age of 18. And the Pfizer one, not approved for anybody under the age of 16.
Okay. And then keeping along with the children, what would you say, is it safe to send my kids, to school starting in the fall, or even some are opening up right now? What would you say that would be the case right now?
Yeah, in terms of severity of illness, COVID-19 definitely does impact patients that have pre-existing conditions and that are older at a much higher rate in regards to those are the patients that end up in the hospital, and those are the patients that can succumb or die from the infection. And so if you're older or if you have a pre-existing condition, that is definitely a risk factor. Now, that does disproportionately affect individuals of color, so brown, African American, individuals, Latin Americans or Latinos, because there's a higher level of pre-existing conditions in those communities. They are disproportionately affected by more individuals getting more sick and having higher fatality rate. That's why it's very important for those communities, especially to be open to vaccination. Now, for children, most children have mild infections. There are some serious conditions that can occur with children at a much lower rate. So I think it is safe for children to go to school, but the simple and kind of the common sense mentality you still have to have. Masking, you still have to be social distancing, you still have to be very cognizant about hand hygiene, all those sort of things. Kids that are sick should not go to school. It just takes common sense responsibility, I think, to have both from the school standpoint and from the parent standpoint in order to allow kids to get educated. A lot of research now shows that the education is very important for the social interaction for children, and that the consequences of having children away from school in terms of mental health issues, lack of socialization, kids falling behind in their education, those consequences are also very severe. So in these sort of things, there's always a balance between public safety and also the consequences of what's happening to our youth. But as we get through this pandemic, I think in the fall, with being still very cognizant for social distancing, still being very careful in terms of masking, doing hand hygiene, it's still very important to maintain all those social protocols for as long as the CDC deems it's needed. When the CDC kind of pulls the plug on those measures and brings us back to some level of normalcy, they'll do it based on data and science and based off of what they're seeing across the country. And so those recommendations, I think we should pay careful attention to.
So you did mention a little bit about masks. If we get the vaccine, do we still need to wear a mask and social distance and keep up with hand hygiene?
So right now, the big concern is that the variants are actually causing exponential growth of COVID cases. So right now in all 50 states, you're seeing the British variant, which is much more transmittable, 50% more transmittable, and potentially more concerning about how sick it makes you. That's the current variant that's pushing out all their variants of COVID. And if you've been watching the news, in Italy, which was, if you guys remember, one of the first Western countries that saw this massive surge and high rates of COVID, they actually are going back to shutdown criteria based on seeing increasing cases. Last week, they had a 10% increase. So right now, the CDC recommends that if you're vaccinated and you've been vaccinated for at least 2 weeks, so 2 weeks from either your Johnson & Johnson dose or your second Moderna or Pfizer dose, you in small group settings with other vaccinated individuals can socialize. And so people think that that's a pretty conservative and a little bit not liberal enough kind of a decree, but that's based on science and based on kind of waiting for the data to show that the case numbers are decreasing. And as they do, the CDC will create more guidelines for patients or for individuals in our country that are vaccinated for how to travel, how to go out to a restaurant, when can you go more socialized, those sort of things. And so right now, we still, even if you have the vaccinations, you should be masking in public, unless you're in a small gathering, like the CDC says, with other vaccinated individuals. You still should be doing hand hygiene. You still should be doing social distancing, because none of these vaccinations prevent you actually from getting COVID-19. Some subset of patients that are vaccinated do get COVID-19, and because only 21% of individuals in our country have had one injection, I think the total number that have gotten 2 injections now is approaching 10%. There's still a lot of people in this community in our country that are not vaccinated, and even if you're vaccinated, you could expose them. So everyone should still use common sense, even if they're vaccinated, unless, like the CDC says, as of right now, they are saying it's okay in small group settings where everyone is vaccinated to have those small social gatherings. But if you're not in that category, you should still be using common sense when in public.
Okay. So just to reiterate, again, if you have had the vaccine, you should still be wearing a mask and social distancing. Also, keeping up with hand hygiene, washing our hands frequently, and not touching things unnecessarily in the public. Also, the CDC has approved for small groups of people who have been vaccinated and for 2 weeks or more to gather in small groups. So that information on maybe when can I go to restaurants, or, can I have a big party like a wedding and such, will come out later state by state. And that is information that you can keep up with. So if you could also speak on the cost of the vaccine. Do I need insurance for it? Is it covered by insurance?
So just in general, I mean, the Pfizer and Moderna vaccinations were very expensive to produce. I mean, these are created in bioreactors. The individual cost of the dose, I think, that is being provided actually by the U.S. government is around $35 per dose. So just think, $65 per person for 2 doses, or 35 times 2, 70 for two doses for one individual. I mean, that's a large cost to society. But all these vaccinations were subsidized that are currently approved by our government. So our government has committed to these companies, in order for them to take the risk to create the vaccinations, that they would buy hundreds of millions of doses. So as of today, every dose that's provided has actually been paid for by the federal government. And so you do not need insurance. You don't need to pay for them. The current doses that are given have been already pre-purchased by the U.S. government. So, and you may ask why. Well, obviously for our economy and our society, the sooner we can start economic activity, the better it is for everybody in our country, the better it is for our government. And so our government is highly incentivized to try to stimulate economic recovery. And the way they've done that is to buy hundreds of millions of doses of all these vaccinations to make sure that our country has enough of these, that nobody who needs it will go without it, because it helps everybody if we all get vaccinated. So the bottom line is, right now, there's no cost to the individual. They're all covered by the federal government.
And could you speak on the vaccine? Am I allowed to, Ramzan is coming up. If I get an appointment during the day while I'm fasting, am I allowed to get the vaccine while I'm fasting?
So on this question, like I said, I'm more like the medical expert, but I know the Imam during Jummah has mentioned that the vaccination is a priority. And so although I defer that to more like a religious authority to confirm those opinions, and I would ask any individual to ask the person they seek guidance from as a religious authority to confirm those. My understanding, just as a lay person like everybody else, is that it is allowed to do so. But once again, I think you should confirm that with the Imam again. If you have any questions about that, you should also confirm it with your religious authority.
Okay, Jazakallah. I think we'll go ahead and move on to some of our guests have some questions. Let's see here. I think we have mentioned, how long does the vaccine protect us from COVID-19? Again, we are not completely sure. So far, the studies have shown that those who were in the initial trials of the vaccine back in March of 2020 are still covered, but that will still be seen in the future, and we will get information on that.
Yeah, so the FDA is actually still following all the individuals that were in all the phase 1, phase 2, and phase 3 trials from last year. And so we've been studying these vaccinations for over a year now. And the FDA follows these individuals and sees if they are getting COVID-19 now or have been in the past. And so if somebody's part of those study trials, we follow them, and that's going to be the group of individuals that helps us know how long we get protection from with the vaccinations. So as of now, we don't know for sure. And we also don't know about the variants that are going to be newly discovered, or how the COVID-19 mutates to know when we will need a booster and how that will look. Already, all the companies have manufacturing abilities and research abilities to quickly modify these vaccinations to also adapt to these new COVID variants.
I think another question, we had talked about some of the side effects of the vaccine, and of course, nobody likes getting sick, but can you speak on if either vaccine has least side effects, or like, with body aches and such?
Yeah, so like you mentioned, the actual symptoms that you feel, quote unquote, side effects of the vaccination, is partly how the vaccine works. So your body has to mount an immune response to create the antibody, because your body is creating the antibody in order to protect itself from the COVID-19. And so any of the vaccinations that are available, let's say you get an option to get one versus the other, you should take it. And there's not any of the vaccines that have not been shown to have some of these side effects, because they all of them have the goal of creating an immune response. So to get a low-grade fever, to get a sore arm, to have a lymph node that enlarges, to get a little redness, to feel kind of a little bit like you're having a low-grade sickness for a day or two. Those are all side effects of a lot of different kind of vaccines, not just COVID-19 vaccine. You can get that from the flu shot, from any of the other vaccinations that are already available. And the reason is because that's how vaccines work. And so we want that response to some degree, but there's not any of them that have been shown to have less than others. The only thing that you should be a little careful of is if you have an allergy to polyethyl glycol, which people that have that allergy, they know that, PEG, then you should probably have the Johnson & Johnson vaccine and not the Moderna or Pfizer vaccine.
Mm-hmm. And this is something I forgot to ask you earlier, but I've heard from some people that maybe you should pre-medicate before getting the second shot, since that is the one that shows more side effects, quote unquote. Do you think that that's a good option to pre-medicate? And then what about afterwards?
And so the local vaccine clinics, most of them do not want you to pre-medicate. So a lot of patients have been taking Benadryl, which is an antihistamine. They've been taking Tylenol, ibuprofen, Aleve, these sort of medications in order to prevent themselves from having any associated discomfort or side effect from the vaccination. Once you have the side effect, it's okay to do that stuff. So let's say you get an injection, you feel like your arm is sore. Then it's okay to take Motrin. If you have a low-grade fever, yes, take Motrin or Tylenol. If you feel like a little itchiness in the site, then take Benadryl. But don't do it before you get vaccinated. Do it after you start having some of the symptoms. So for example, if you get some of these, you don't feel quite good, then do those medications. But the recommendation is don't pre-medicate, because like I said, the goal of the vaccination is to create antibodies. You have to have some level of inflammation to do that. And so you can treat the side effects, but don't preemptively treat the side effects. So wait till you start having some of the symptoms, because some people feel nothing and some people will have some side effects. If you have them, it's totally okay to take the medications, but don't do it before.
Okay. Another question we have is, if you get Moderna as your first shot, let's say maybe they don't have it available again as a second shot, like you mentioned, is it okay to get the Pfizer one as a second dose?
Yeah, I mean, the answer right now is you should wait. So right now, the research, because everything is based off of science. Right now, the science shows that you should do the same injection for the 2 injection regimens, either it's Moderna or Pfizer. You should get the same one as a second dose. Now, if it's not done exactly at day 28 or not exactly at day 21, that's also okay. And so if there's a gap longer than it's supposed to be, it's still recommended to do the same vaccination as you had your first dose. So do not mix. If right now there's a lot of different ways to sign up for the vaccine. You can sign up on websites, you can call in. Different centers have different types of vaccinations. but it's very important to make sure that you get the same vaccine the second time if you're in the Moderna or the Pfizer group.
Thank you. We talked a little bit before about wearing masks. If you could just reiterate that again, if we get the vaccine, do we still need to social distance and wear a mask?
So like we mentioned, as of today, and like I said, this is the changing recommendation, and it's going to change throughout the whole year as the COVID-19 pandemic kind of evolves. But as of today, you still need to wear a mask if you're vaccinated, unless you're in a small gathering with other individuals that are also vaccinated, and it's been about 2 weeks since everyone's been vaccinated. And so if you're in a small family group or small get together and everyone's been vaccinated and it's been 2 weeks since the vaccinations, then yes, it's okay not to wear a mask. However, if you're in public, if you're out and about, if you are not in that specific recommendation group, then yes, you should still social distance. You should still mask. You should still be very vigilant about like hand hygiene and those sort of things. So yes, it's still important to wear a mask unless you're in that narrow definition of what the CDC says you currently can do without a mask, which is with other family members or other friends, small group settings where everyone's vaccinated and it's been about 2 weeks since the person's last vaccine, then it's okay. And this is how you're seeing some of the grandparents now are seeing their families, is because of that recommendation. But if it's not for that group of individuals, yes, you should wear a mask still in public or otherwise.
I also forgot to ask you this earlier, but is it mandatory to get the vaccine? Like, can my employer make me get the vaccine?
So the government rule is that actually your employer could force you to get the vaccine, but no employer currently that I'm aware of is doing that. And so some of those regulations are state to state or changing, but currently I'm not aware of anybody who's forcing a vaccination. Even in our healthcare center, it's still voluntary. So, but I think there is some provision present that if an employer really, really wanted to, they could, but no employer, I think, is currently doing that I'm aware of.
Okay. You mentioned at the beginning the time frame it took to create the vaccines and approve them. Can you speak on, some people are concerned that it happened really fast, compared to other vaccines. Can you speak on that?
Yeah, so the mRNA vaccinations, or the mRNA vaccine technology, it's actually been around for a little bit of time now. The last 5 to 10 years, Moderna, if you look at the name, the last is Moderna, RNA. So that company has actually been specifically looking at RNA technology. So for example, like the Ebola vaccine and some other vaccines that are currently being studied are actually based off of that technology. The beauty of that technology is that it does not need like another virus to infect us in order to create that vaccination. It uses our own body in order to create the vaccine. And if you look at what we've had happen in the last year with the pandemic being worldwide, a lot of research and billions of dollars have actually been funneled just into this one cause. So I agree that a lot of times vaccines take years to develop. And a lot of that's because there's not a lot of research being done. There's not enough money in order to do the FDA studies. The demand may not be like 100% there for the companies to put all the resources into it. But for this particular vaccination, the whole world has pretty much dumped a lot of intellectual, a lot of financial, and a lot of physical resources to develop these vaccines. And these vaccines were actually developed last year. And so within about 10 to 14 days after the sequencing of the COVID-19 virus, we already had like target vaccine data. So last January, this technology was already like in the process of vetting a vaccine. The whole last year we've spent has been in getting the trials done to make sure that the vaccine is safe and effective. So although the vaccines were really approved in the winter, kind of in that December timeframe was when the Pfizer vaccine, and in January, the Moderna vaccine was FDA approved. there were tens of thousands of individuals that received those vaccines last year in the spring, and we studied those individuals to make sure that these vaccines were safe and effective. So although it seems like it was just all of a sudden in January or December that these vaccines showed up, they actually were in the process of being studied even last March, last January, last February. So.
Okay. Lastly, I see, are essential food processing workers like Tyson eligible for the vaccine right now? I think the counties are on phase 1B.
Yeah, just specifically for Tyson, I think I heard on NPR last week that I think they were vaccinating their plant specifically. So I'm not sure if that was a Tyson plant in the Quad Cities or elsewhere. But for those kind of specific questions, what I would do is I would ask those individuals to talk to their human resources departments, and then they can instruct them in terms of like where they should go or where they kind of qualify in that line or queue.
All right. If anybody else has any other questions, you can put them in the chat. Is there anything else that you think that we should know about the vaccine process or the vaccine itself?
Yeah, I mean, for example, I got the vaccine. I got the Pfizer vaccine in December as a healthcare worker, just as an example. And the reason I think a lot of our leaders, politicians, other individuals are publicly getting the vaccine is in order to show that there has been a large process to get to this point. And so, you know, it's kind of through the grace of God that we as a world have come this far. And all pandemics are like marathons. And so although everyone is kind of very anxious to return to more normal economy, normal society, normal interactions, we have Ramadan coming up very shortly. You know, this pandemic kind of really changed how our Ramadan was last year. So I know there's a large pent-up demand for all sorts of things, but as in all things, a little bit of patience at this stage, a little bit of common sense, a little bit of all those sort of things are going to be very helpful to help make sure that we do our part to make sure this pandemic ends as fast as possible with the least number of people being affected. And although we see big number decreases, I mean, every day in this country, there's right now, between 1,000 and 1,500 people or a little bit more that are still dying every day. Still 60,000 plus people that are still getting COVID every day. And so and these are, you know, and we have vaccines. And so people are waiting very patiently. There's a lot of people that I see in clinic that are still unable to receive the vaccine. And so if you have the availability to get it, I would encourage everyone to get it. If you have questions about it, I would ask you to talk to your doctor, talk to your healthcare provider. If you don't have a healthcare provider, you know, talk to family and friends that are in the healthcare industry. But I think it's very important to get the vaccine. I think it's important to know the vaccine is not political. The vaccine is just a public health entity. It's kind of the vaccine doesn't discriminate, as COVID does not discriminate against religion, you know, color, economic status. I mean, anybody can get the disease. At the same time, everyone who has access to the vaccination, once their turn, they should get the vaccine, not only to protect themselves, but also to protect their neighbors and the community.
Okay, Jazakallah. I see one more question in the chat. You mentioned earlier about different vaccines from different countries. Can you speak on maybe the Chinese vaccine, I believe called Sinopharm and Sinovac, if those are being tested in the United States or other countries, and are they safe and effective?
So like I said, in our country, the bar in order to jump over to get a vaccine approved is very, very, very high. And so we have very stringent controls at the FDA that are, in my opinion, more stringent than the Europeans and anywhere else in the world. And it's on purpose. It's to make sure that whatever we have as a medication offered in the United States for vaccination, it's truly safe and effective. You know, all these concerns that people have about it's too fast, it's too new, worried about complications or long-term side effects. We thankfully still have a very strong scientific community that kind of creates a very high bar or standard in order to pass these vaccinations and get the approvals. So as of now, AstraZeneca, the Sinovac, Sputnik 5, although they're used in Middle Eastern, Southeastern countries, other countries, European countries, they have not met or been vetted by our FDA to meet the standards that we have in our country right now in order to get approved for use in the US. That does not mean that they're not effective. It does not mean that they're safe. It just means that we have not studied them and don't have the information needed to say that they're okay to use in this country.
Jazakallah, I appreciate your time. Just to give a quick summation of this seminar, COVID-19, as we all know, is still a problem in our country. We see high rates of infections and high rates of deaths. So it is still important to wear a mask and social distance, keep up with hand hygiene. If you are eligible for the vaccine, it is strongly recommended that you do so. There are 3 options currently in the United States that are approved: Pfizer, Moderna, and Johnson & Johnson. Pfizer and Moderna are 2 doses, while Johnson & Johnson is just 1. If you have any questions regarding if you are eligible or if you have any safety health concerns, please contact your healthcare professional, your healthcare provider, and they can help you out right there. Again, Jazakallah, Brother Suleiman, for joining us today. And I pray that, inshallah, everyone will be able to come back to normal life and we will be able to join in the masjid together, inshallah, very soon.
Thank you so much for having me.
Yes, of course. Assalamu alaikum.